This is a topic that I first got personally focused on before I became a researcher at the Urban Institute, when I ran a child welfare agency in the District of Columbia, and that was an agency that dealt with abused and neglected children. And what I really thought a lot about was how parents who really want to do the best for their children end up in the circumstance where their children are not thriving and they can't take care of them. And so I got very interested in learning what is it researchers can tell us about how you could prevent children getting involved in the child welfare systems. As I began to understand the research that was out there, I realized that the hunch I'd come with, that depression is a very big issue for low-income moms raising young children, and that it is something that's treatable, that researchers have confirmed those things. First of all, it's widespread among mothers at all income levels, but particularly among poor mothers of young children. Second, it's very damaging to young children if it's untreated. And there are a couple reasons for that. One reason is that a mom who's depressed, especially severely depressed, won't be able to take some of the normal actions parents take to keep their children safe and healthy, not be able to get to the doctors, not be able to remember to put in the car seat. But the second reason is that young children learn, they develop cognitively and emotionally and the foundation for all of their development is about their caring and nurturing relationship with a small number of adults. So a mom who can't take any joy in her baby, who can't coo at her baby or talk to her baby because she herself is so drained and depressed, has the potential of damaging that child's development. At the same time, one of the things that makes it so sad that depression has these impacts is that effective treatment is available. The Institute of Medicine says that it's one of the most treatable of all mental health issues. And finally, the evidence suggests that a great deal of depression goes untreated. So I came away from learning that research thinking, this is an opportunity to intervene, we know what works, in a way that could potentially make a big difference to young children. We were able for the first time to look at a national sample of babies called the Early Childhood Longitudinal Survey Birth Cohort. So it's a sample of babies from all over the country. And we honed in on babies born to mothers in poverty. And we found that among that group, 1 in 9 of those babies' mothers was experiencing symptoms of severe depression, more than half symptoms of depression at any level. Looking at those babies in families that were poor, who had mothers who were severely depressed, those infants were growing up facing a whole host of disadvantages. Because when a baby's mother was depressed, a lot of other stresses were more likely. Domestic violence, those mothers reported being hit at higher levels, substance abuse, and worse maternal health. Mother's own health was less good. Those babies also were having the mother's nutritional behaviors were less good. They were breastfed for a shorter period of time, for example. And then we looked at the question of whether these mothers get help, and what we found was very sad and very consistent with earlier research, that even for mothers reporting symptoms of severe depression, only 30% told the interviewer that they had even once talked with a doctor or a counselor or a mental health expert about their symptoms. So very few of these mothers are getting help. We actually did find good news when it comes to the perspective of could you make a difference? Because what we found was that even though these moms had very difficult lives, they were in touch with some people who could help. First of all, despite all of the stresses in their lives, they were getting their babies to well baby visits. On average, those babies had had about 6 well baby visits by the time the mothers were interviewed when they were 9 months old. And second, they were in touch with some kinds of public programs that could help. Almost all of the mothers, about 95%, or almost all of the babies, lived in a household where someone was getting WIC benefits. That's the Special Nutrition Program for Women, Infants, and Children, and it's a program that helps pregnant women and mothers with young children get nutritional benefits, get help eating. And so that was a program that had potential, that saw these mothers. And second, about 80% of the babies were in a home where someone had Medicaid, that is public health insurance, probably for the baby. So that was another opportunity. So we came out of that paper thinking, this is very troubling. These babies are growing up in very difficult circumstances and it could have a lifelong effect, but we don't have to let that be. If you work in a program that sees mothers with babies, or if you are interested in your neighborhood, in your community, what I think is the takeaway message from this paper is that depression is quite prevalent, it's damaging to young children, and it often isn't treated. And if those of us who see moms and see young children recognized it, rather than just thinking somebody was lazy or disorganized or just tired or should just deal with it herself, we might be able to make a difference that would resonate over the years in those babies' lives.